So we'll be talking about diabetes mellitus under the following objectives. And that's overview, signs and symptoms, causes, risk factors, complications, prevention, and conclusion. We will not be discussing diagnosis, management, including treatment. It's a pretty wide topic. So at a later date, we're going to be discussing about those ones, and hypoglycemia, and maybe diabetes insipidus as well. So diabetes mellitus, refers to a group of diseases associated with inadequate control of blood glucose. In other words, people would call it blood sugar, which is vital to health, because it's an important source of energy for the cells that make up the muscles, tissues, and also the brain. And there are various sub-classifications. Now, diabetes mellitus is not just one. It has sub-classifications, which include type 1 diabetes, type 2 diabetes, maturity, onset diabetes of the young, steroid-induced diabetes, pre-diabetes, and gestational diabetes. But today we'll be talking about the chronic diabetic conditions, which are the type 1 and type 2, and the potentially reversible conditions, which are the pre-diabetes and gestational diabetes. Now, diabetes are signs and symptoms. Before I go into the signs and symptoms, I'm going to explain the meaning of signs and symptoms. Now, symptoms are what an individual presents with in the hospital. When you go to see a doctor, how you're feeling, what you tell the doctor that, oh, this is how I'm feeling, that is what we call symptoms. And signs are what the doctor sees or the physician sees and relates it to the condition and to make a diagnosis. So for diabetes, the symptoms vary depending on the level of the blood sugar in the bloodstream. And type 1 diabetes develop at any age. And although it often appears in children and adolescents, but type 1 diabetes majorly is caused by it's actually an autoimmune disease. By this I mean the immune system of the body attacks the body itself, thereby destroying the pancreatic, gland that produces insulin. I'm going to get to that as we move on in this presentation, so we tend to understand what causes type 1 and type 2. So in type 1, there's destruction of the gland that produces insulin, and in type 2, which is usually more common in adults above 40 years, although can also develop at any age, is caused by the resistance of the cells of the body to the insulin that is being produced. In type 2, the gland is not destroyed, it produces insulin, but the body is just resistant to the action of the insulin. So the signs and symptoms, these signs and symptoms cut across the type 1 and type 2 diabetes, which includes polydipsia, which is increased thirst. The individual, is just thirsty, wants to take fluid at all times. Polyuria, which is frequent urination. And this usually is a distressing situation where the individual would usually wake up at night several times to go and use the washroom. So it disturbs the sleep and could be very distressing. Polyphagia, which means extreme hunger, unexplained weight loss, extreme fatigue, irritability, blurred vision, sores that do not heal or heal poorly, frequent infections such as gum infections, skin infections, and in females, vaginal infection, especially the yeast infection. Now, there's also the presence of ketones in urine. Now, what are ketones? I'm really sorry, I'm going to be doing a lot of definitions so we can understand. Ketones are the byproducts of the breakdown of muscles and fats in the body when there's not enough insulin. So when this condition happens, when the individual goes to see the doctor and the doctor asks for a urine test, there's usually ketones in the urine. So this is one of the pointers of type 2 diabetes. Decreased sexual drive in males and erectile dysfunction. So like I mentioned earlier, we'll be talking about 3 major things that cause either type 1, type 2, pre-diabetes, or gestational diabetes. Now, the pancreas is one of the glands in the body, and it is located behind and below the stomach. And this pancreatic gland produces a hormone called insulin, which helps to drive blood glucose in the bloodstream into the cells where they are needed. Because the cells, the systems in the body are made up of several cells which need energy to function. So the insulin helps to move these blood glucose into the cells where they are needed. And glucose can come from two major sources, which is the food and the liver. Now, when we eat, the stomach, converts this food into glucose, which is moved into the bloodstream, and and insulin drives it into the blood cells where they are needed. But after the cells make use of the ones they need, the excess glucose is stored in the liver as glycogen. And so another set of hormone that is produced by another type of cells in the pancreas produce glucagon, which helps to break down this stored glycogen to glucose when the body needs it. Now that's the reverse. So it breaks it down and sends it, especially when you're hungry. The body, tries to complement this process by breaking down this glycogen to glucose, and then takes it to the cell, to get the energy before you eventually get to eat. Now, type 1 diabetes in itself, the cause is unknown, but it's an autoimmune disease. Like I mentioned earlier, the immune system just attacks the body, attacks itself, and in this process destroys the pancreatic gland. So there's little insulin produced to help drive the excess blood sugar into the cells. And another cause is viral infections like the mumps, Coxsackie virus, German measles, etc. Now, when someone comes down with a viral infection, it can trigger the immune response. It can trigger the immune system to attack the body and thereby destroy the pancreatic gland, so that little insulin is produced to help drive this glucose into the cells. So these are the causes thought to be the causes of type 1 diabetes. Well, pre-diabetes in itself is, I know some of us have been to the physician and they say, oh, you're pre-diabetic, watch what you eat and stuff. So pre-diabetes in itself is a condition where an individual has high level of blood glucose in the bloodstream, but it is not high enough to be diagnosed as diabetes, type 2 diabetes. So it's like a precursor for type 2 diabetes. While type 2 diabetes is caused by the action of insulin, resistance to the action of insulin by the blood cells. Now, here, the pancreas is not destroyed. It produces insulin. But the cells that are required to take up this excess blood glucose are resistant to the action of this insulin. So it causes a buildup of blood glucose in the bloodstream. And so although the pancreas will try to, produce more insulin, but in most cases cannot do so much, can only do so much. So there's a buildup of glucose in the bloodstream, and that's the cause of type 2 pre-diabetes and type 2 diabetes. So these are like flow charts showing us how diabetes, type 1 diabetes and type 2 diabetes are caused. Now in type 1 diabetes, yeah. Can you see the red? No, you can't. Okay, let's just go ahead. Oh, okay. Okay, so type 1 diabetes, we can see that the stomach changes the food into glucose, and the glucose enters into the bloodstream. Now you can see the pancreas at the back of the stomach there in the abdominal cavity. It's usually in the abdominal cavity, so you can see the pancreas behind the stomach there. And once the glucose enters into the bloodstream, the pancreas makes little or no insulin because part of it has been destroyed anyway, so it can only make so much. And this little or no insulin enters into the bloodstream, and tries to push as much as it can into the cells. But there's always a build-up because there's not enough insulin, so glucose builds up in the bloodstream. While in type 2, the stomach converts the food in glucose like type 1, and then the pancreas creates sufficient insulin, but the body is resistant to it. So glucose is unable to enter the blood effectively, and there's also a buildup of glucose in the bloodstream. So in both cases, there's a buildup of glucose in the bloodstream, but it's just the pathway that is different. Now, it is believed that genetics and environmental factors play a role in the development of type 2 diabetes also. But being overweight is strongly linked with the development of type 2 diabetes, but not everyone with type 2 diabetes is overweight. Now, I'm going to say that again so we can understand now. Being overweight or being obese is strongly linked to the development of type 2 diabetes, but not everyone with type 2 diabetes is obese. Gestational diabetes, now some people have experienced this, is when a woman is pregnant and the placenta would usually secrete hormones to support the pregnancy. For example, the progesterone, estrogen, cortisol, human placental lactogen, and so on. So we produce these hormones to help support the pregnancy. But these hormones also cause insulin resistance in cells. And so the pancreas would respond by producing extra insulin to overcome this resistance. But sometimes the pancreas can't keep up as usual. So very little glucose is pushed into the cells, and there's a buildup of glucose. But in gestational diabetes and pre-diabetes, you would usually not see, the patient would usually not complain of any symptom, or like type 1, that you get to see the symptoms or signs on time. But in gestational diabetes, most people would usually just get to find out when they go in for their routine checkup, when they do the OGTT and stuff at 24 to 28 weeks of pregnancy. Now, the risk factors of type 1 diabetes, they are family history. If a parent of an individual or the sibling of an individual has or has had the condition, then there's a likelihood that the person will develop it. Likelihood. So, and age, when an individual is 45 years and older, environmental factors, but this has not been, clearly defined. And then the presence of damaging immune systems, that's autoantibodies in the body. Now, geography also plays an important role in the risk in developing type 1 diabetes. By geography, I mean people that live in the northern climates, where it's pretty cold. They tend to stay in clusters. So they usually would not go out spread, but when they stay in clusters, it's easy for a viral infection to be spread around that cluster. So once one of them comes down with a viral infection, it spreads around, and viral infections, like we know, can trigger the immune system to attack itself and destroy the pancreatic gland. Now, pre-diabetes, risk factors for pre-diabetes and type 2 diabetes. Obesity is number one. That's being overweight, right? Okay, obesity. By obesity, I mean when the body mass index, that's the BMI, is greater than 30 kilograms per meter square, or overweight is when it's 25 to 29.9 kilograms per meter square. Now, when you have these two, I know we can calculate that ourselves at home, weight over height square. If you know your height and if you know your weight, the formula is weight divided by height squared. So if it's between 25 to 29.9, then it means you're overweight. Or if it's greater than 30, then it means you're obese. So inactivity also can predispose to pre-diabetes and type 2 diabetes. By inactivity, I mean sedentary lifestyle, where we usually, not involved in active, in activities, So it's advisable that we take out at least 30 minutes, a day to get involved in aerobic activities like, walking or cycling or stuff like that, or you can engage in 150 minutes of aerobic exercises, over a week. Now, also age, when you're greater than 45 years, poses a risk for developing type 2 diabetes. Family history, parents or sibling, if they've had it or if they've had it or have it right now, then the individual is at risk of getting it. But note, if the father has it, there is a slightly higher chance of the individual getting it than if the mother has or had it. So pre-diabetes in itself, like I said earlier, is a risk factor itself of developing type 2 diabetes. It's a precursor of type 2 diabetes, and the history of gestational diabetes can predispose to type 2 diabetes later in life. If a pregnant woman had gestational diabetes, there's a possibility that she might develop type 2 diabetes later. Now, PCOS, some of the women are familiar with this term, PCOS. It's polycystic ovarian syndrome, and it means when a woman's ovary produces abnormally high amounts of the male sexual hormone, which is called the androgen. This increases the resistance of the body cells to the action of insulin, so that individual might later come down with type 2 diabetes. Now, high blood pressure, greater than 140/90, also poses a risk of developing type 2 diabetes. Now, high levels of cholesterol or triglyceride. By cholesterol, I mean, there are lipoproteins in the body, with the high density lipoprotein is actually termed the good one. So if you have reduced levels of the high density lipoprotein, then there's a risk of developing type 2 diabetes. Now, race or ethnicity for type 2, African Americans, Hispanic Latinos, and people of Asian American ancestry have been known to be predisposed to developing type 2 diabetes, unlike type 1, where in America the Caucasians are more susceptible to having type 1 diabetes. Now, for gestational diabetes, any woman above the age of 25 is at risk of getting gestational diabetes when she gets pregnant. And a history of gestational diabetes in a previous pregnancy would predispose to, another one, or type 2 diabetes, like I mentioned earlier. Now, family history of type 2 diabetes would also predispose to gestational diabetes, obesity, or being overweight, PCOS, like I earlier mentioned, and race or ethnicity. Now, the complications, there are a lot of complications of diabetes, a whole lot. I'm just going to be, talking about very few of them. So, cardiovascular disease. Now, diabetes, it increases the risk of getting cardiovascular disease. Once a person has had or has type 2 or type 1 diabetes, then there's a risk of the person developing heart conditions like stroke, heart attack, atherosclerosis, that's thinning out of narrowing of the blood vessels. They're at risk of having those. And then nerve damage. When there's too much glucose in the bloodstream, it tends to damage the tiny blood vessels called the capillaries that nourish the nerves. And this leads to nerve damage, also known as neuropathy. And if this happens in the foot, that's when you have the foot conditions where a cut or an abrasion can lead to an infection, and then death of either the toes, the foot, or the entire leg, and it can lead to amputation. So these are really serious complications of diabetes. Now, if there's diabetes can also cause eye damage. That's retinopathy. That's if it affects the blood vessels in the retina of the eye, causing hemorrhage. And so this is known as diabetic retinopathy, which can lead to blindness or other conditions like glaucoma, or cataract. Now, in the kidneys, there are various tiny blood vessels that help to filter the waste in the blood. They filter the waste in the blood, but when a person has, or an individual has, high levels of glucose in the bloodstream, these glucose tend to damage this very delicate or sensitive system. And so these can lead to kidney damage, kidney failure, or even end-stage kidney disease, and the individual might require dialysis or even a kidney transplant. And I mentioned foot damage, how it affects the foot, and it can also predispose to skin conditions. A lot of skin conditions are seen in individuals with diabetes that is poorly controlled or uncontrolled at all. And then such skin conditions include bacterial or fungal infections. Also, hearing impairment is common in patients with diabetes. Diabetes is related, it also causes dementia, seen in Alzheimer's disease, and is also associated with depression. Now, this is, I'm sorry, viewers' discretion. So I'm going to bring in up some pictures. I hope it doesn't. Okay, so this is like stages of the foot, from the normal foot to when it becomes unsalvageable, and then they have to do the amputation. So we can see here in stage 1, there's the normal foot, and then there's the iris foot where you have the abrasions just under the toes there, and then it becomes a full ulcer which becomes infected. And stage 5 is when you have the necrotic toe. You can see the toe, the color of the skin over the toe is totally different from the other parts, and it shows that that part is dead. And if care is not taken, it's going to lead to, in fact, not care is not taken, it will have to be, taken out of the body. And so this is also a diagram showing diabetic retinopathy. To my left, is the normal eye, and to the right is the diabetic retinopathy. You can see the hemorrhage here. Diabetes causes hemorrhage in the retina, and which can lead to blindness. Now, these are also common skin conditions linked to diabetes. You can see folliculitis, boils, all of that skin conditions are associated, a lot of skin conditions are associated with diabetes. Now, complications in gestational diabetes. we are going to divide this into two broad classifications: complications in the baby and complications in the mother. Now, the baby can have growth increase, unnecessary growth increase. It's not all the time that you have babies that weigh 4.2 kilograms at birth. You think, oh, my baby is healthy, I ate very well, I took great care of this baby. No, it's most likely gestational diabetes. It means the baby was exposed to the excess blood glucose in your blood that crossed the placenta into the baby, which caused the baby, to keep producing insulin to help push this blood glucose into his or her own cells, and then the baby will just continue to utilize this energy and grow. And this is, they are usually large for gestational age. Now, the complications also in babies can result in premature birth, stillbirth, jaundice, low blood sugar, and type 2 diabetes later in life. And in mothers, they can come down with preeclampsia, which is a condition that involves high blood pressure, protein in the urine, and swelling of the feet, and then subsequent gestational diabetes in other pregnancies. Now, this is also a diagram showing you the difference between a baby that has macrosomia and an average size. Both of them are newborn, but you can see one is bigger than the other. So this is the average size newborn, and then this is the baby from a mother with gestational diabetes. So prevention of type 1, type 2 diabetes, pre-diabetes, gestational diabetes. Type 1 cannot be prevented. Once the immune system has been sparked to attack the body system, there's really nothing we can do about it. It goes ahead and attacks the pancreas. But other factors can help to, modify, lifestyle modifications can help type 1, and all these other ones can also prevent type 2 and pre-diabetes and also gestational diabetes by eating healthy food. Foods low in fat, high in fiber, less sugar, less carbs and all. Now, increased physical activity, like I mentioned earlier, at least 150 minutes of aerobic exercise per week would really help. And then if you can lose at least 7% of your weight, it will also help prevent the development of type 2 diabetes or pre-diabetes. Now, if reduce saturated fat and refined carbohydrates, that's also part of eating healthy, and then eating smaller portions of food, so you have less glucose, being pushed into the bloodstream. Now, in conclusion, I hope I have my 4 minutes. Okay. In conclusion, I'll be talking about the myths of diabetes as a conclusion. So, diabetes is not caused by eating too much sugar. Yes, sir. It's shocking, yes. It's not caused by eating too much sugar. But when you eat foods high in carbohydrates, fine, it gets converted to glucose in the body, which results in being overweight or being obese, which is a high risk of getting type 2 diabetes. But it's not once I take like 3 bottles of Coke. Take 3 bottles of Coke, it doesn't exactly lead to, diabetes like that. It has to go through that process to get to that point. Now, type 2 diabetes is not a mild condition like people would say, because sometimes they just place them on lifestyle modifications because they don't sometimes they won't prescribe medications, they just place them on lifestyle modifications for a while to see if they can control it. It is not a mild condition, so we shouldn't take it with levity. Now, people with diabetes do not have to follow a strict special diet. I would say that because even for those without pre-diabetes or type 2 diabetes, we are all supposed to eat healthy. Like eat healthy, balanced diet that includes fruits, vegetables, proteins, lean meat, low-fat dairy, and all that. So, and also, people with diabetes can eat fruits along with their vegetables. Now, fruits we know come with natural sugars, but you can't compare the level of the sugar in the fruits with that in, cakes, ice cream, biscuits, and so on. So they can take it in moderation, because fruit also is high in fiber and also contains some other vitamins that is essential to the body. Thank you very much.